Hello, my name is Claire Chavez, and I'm a doctor of physical therapy here at Christus St. Vincent Hospital. Today, we are going to discuss how your vision might be affected after a stroke and how these problems can be treated. This is an important topic to talk about because as many as 2/3 of people experience changes in their vision after a stroke. It is important not to ignore changes in your vision and to talk to your doctor about them. There are different ways that a stroke can affect your vision, and this depends on where in your brain the stroke occurred. The four main types of visual problems after a stroke are central vision loss, visual field loss, eye movement problems, and visual processing problems. Now, I'm going to talk about each of these problems in a little more detail. Central vision loss is the partial or complete loss of vision in one or both of your eyes. A retinal stroke only affects the eye and happens when the blood vessels to one eye become blocked. Symptoms of a retinal stroke might include blurring or blackouts of vision before the stroke. More often, visual problems happen due to a stroke that occurs in the brain. Symptoms may include being unable to see anything at all or only being able to see things around the edge of your vision rather than in the center. Treatments include using magnifiers or minimizers, which are used to help focus in your remaining area of vision, or anti-glare glasses. Your visual field is everything that you see, both in front of you and to the sides. After a stroke, you may be unable to see properly either to the left or to the right of the center of your visual field. Different areas of your visual field may be affected depending on where in your brain the stroke occurred. The most common type of visual field loss is due to a stroke in the back of your brain, and is where you're only able to see the right half or the left half of your world out of each eye. This is called homonymous hemianopsia. Other types of loss include the loss of 1/4 of the visual field, loss of either the entire upper or lower field of vision, or missing patches from the visual field. It is very common to have trouble reading with visual field loss, especially due to the inability to locate the beginning or end of a line of text. ReadWrite is a new free treatment available to help with increasing speed and accuracy while reading. Treatments for visual field loss include widening the visual field with optical aids worn on glasses or on one's blind side. Compensatory strategies such as visual scanning training, which encourages looking to the left and the right in a systematic way. Another option is visual restorative treatment, which works to help a person to interpret visual information, such as increasing awareness of moving objects on one's blind side. Eye movement problems can affect your ability to follow a moving object or look from one object to another. This can affect both reading and mobility. It can also result in an inability to move both eyes up, down, sideways, or inwards. This may cause blurred or double vision and is sometimes called a squint or strabismus. Constant eye movement, which is called nystagmus, can be very disorienting. This is a sign of your eye's attempt to compensate for mixed messages coming from the left and the right side of your brain. Impaired depth perception can lead to difficulty locating objects. For example, you may have difficulty pouring liquid into a cup. Treatments can include eye exercises to help with the coordination of head and eye movements, or eye movements following moving targets. Optical aids, such as prisms, can adjust how you see objects, such as merging two images into one. Eye patches can also prevent double vision, but they only allow for the use of one eye, so they're not usually a first option for interventions. Our brains process incoming visual information to decide what it means. This allows us to recognize things such as colors, faces, or objects. This process can be damaged by a stroke. Visual neglect is the most common visual processing problem, and it affects your awareness and perception of one half of your environment. This means that you may be unaware of anything on that side of your body that has been affected by the stroke. You may also observe someone will neglect failing to eat any food on one half of their plate. Visual hallucinations are another common visual processing problem. Treatments for visual processing problems include the use of adaptive strategies, such as using one's other senses, such as touch or hearing, to process information. Prisms, eye patches, and mirrors may also be used to attempt to increase awareness. some recovery may also recur on its own with time. Other possible eye problems include weakness of facial and eyelid muscles, which might make it difficult to close one eye, which makes that one eye dry and irritated. Eye drops or ointment can be used for this. Sensitivity to light, called photophobia, can be managed with tinted glasses or sunglasses. You will be referred to the right type of eye specialist after you leave the hospital if your visual, eye coordination, or perceptual problems are not resolving on their own. Now, I would like to talk about visual problems in regard to driving. In the state of New Mexico, senior drivers aged 75 and older must undergo a basic vision test on a yearly basis. If you wear eyeglasses, make sure you bring them to the MVD for this. The minimum vision standards include 20/40 in one eye, with or without correction, the ability to see out of the corner of your eye, and the ability to judge your car's distance from other vehicles. If you do not meet these minimum standards, the MVD will refer you to a licensed specialist for vision. As a driver who has had a stroke, you are required to keep the MVD updated of your medical status by getting MVD-issued paperwork signed by your doctor. Drivers with a history of seizures must remain seizure-free for at least 6 months before they resume driving. You may have to undergo an MVD re-examination, which reevaluates your driving skills by assessing your physical and mental condition and/or your driving record. This re-examination might include a vision test in addition to a written or driving test. Poor vision is the most common condition that can affect your ability to drive safely, and you could have restrictions placed on your license as a result. These restrictions help to keep you and others safe by ensuring that you are driving within your abilities. Restrictions vary, but could include being required to wear eyeglasses or contact lenses, only driving from sunrise to sunset, avoiding rush hour or freeway driving, limiting the geographic area in which a person is allowed to drive, requiring additional mechanical devices or extra mirrors, or requiring extra support to assist in safe and proper positioning for driving. Ask your doctor if you have any specific questions regarding your readiness to drive, or what other specialists may be able to help with any lingering vision problems that persist after your stroke. If you have any further questions regarding vision problems following a stroke, please follow up with your rehab team. Thank you for your time and have a great day.